Hi, it's the nursing professor here today. And first of all, before I get started, I want to thank you all for all the kind words and condolences that you've sent over the past weeks. Next, I want to ask you all to do me a favor. I want you to like and share the video such that it pushes it forward so that more people can actually see the video. All right, because what I have noticed since I've been away is that you all are looking back at all those old videos. And so that really warms my heart because it says to me that information has been very valuable to you all. But the amount of likes that I've gotten since I've been off YouTube for 2.5 months is really a lot. And I thank you all for that. So let's get into the video. Things that you must know before your next exam. All right. So first we want to talk about ABCs. It's not enough for you to know airway, breathing, circulation, because you can memorize those concepts, but you need to really know how to put those into play. So first on the list is this. When we're talking about airway, if you're given any type of problem and it tells you that person's airway is closed, is compromised, you can't do anything else until you're able to open that airway, right? Because all the other steps, the breathing, the circulation can't happen if you're unable to open the airway. So I want you to really, really think about that and think about all the CPR classes that you've taken. If you're unable to open that person's mouth, unable to obtain an airway, you can't get oxygen in and that person is gone. All right. So when you're thinking about priority questions, please really do think about airway, breathing, and circulation, and understand that if number one is not available to you, it's finished. Okay. All right. Next on the list, and this one is as equal of a priority, is knowing your electrolyte values. The body is always trying to seek homeostasis, right? So you remember balance, homeostasis. If one electrolyte is off, then another one is going to try, the body's going to try to compensate for this and that. So let's take for an example, potassium. Potassium is vital to our existence. So normal potassium is typically about 3.5 to 5.0. All right. And so potassium really helps with the functioning of your heart. So it's quite involved with cardiac functioning. So if it's too high, that can be lethal, meaning that person actually can die. All right. So what are some symptoms of an elevated potassium? Person can have chest pain. They can have chest palpitations. They could feel like their heart rate is irregular. They might even have some abdominal pain or nausea and vomiting. So we've got to get that thing down. So what can we possibly do for that person that has an elevated potassium? We can give them a diuretic. We know that if we give a diuretic, a person can pee and they're going to lose some potassium, right? Next, we can think about, and this one is used most common, is insulin, IV insulin with glucose, because what happens is it literally pushes the potassium from the blood back into the cells. And so therefore it lowers the potassium levels in the blood. You can also, especially if a person has renal impairment, you can also do hemodialysis. That will be a quick fix to an elevated potassium. Because again, elevated potassiums are lethal to a patient, meaning that they can actually kill a patient. Last but not least, sometimes you can consider it a quick fix, is Kexolate. It's a medication that you give by mouth. It helps the person have basically diarrhea, and they're able to excrete the excess potassium that way. All right. So next, we can also think about if the potassium is too low. All right. And so equally, that can be a problem for a patient. And so we want to make sure that we are replacing the potassium. So that person can feel really, really weak. They can also have arrhythmias, meaning they can have irregular heart rhythms, but frequently they can't even lift their arms. The other night, you might, if you all are Pit viewers, because I'm a fan of that show, if you took a look at that, there was a young man that came in and he had been in a car accident. And so the assumption was that he was having problems moving his extremities because there would have been some sort of injury to his spinal column, right? And that's a good assumption. But what they found was his CAT scans, his MRIs were negative for that. And so then they started to delve in a little bit more and they found that the potassium was 1.2. Yes, 1.2. Now, you saw them kind of dilly-daddle a little bit around, and before they replaced that potassium, and I was sitting there like, replace the potassium. But it was so critical for his potassium to be replaced such that you saw in a matter of moments, especially for TV purposes, that he was able to raise his arm. So remember that that is the case for potassium, but you got the other electrolytes that you need to go and study yourself, like sodium, phosphorus, magnesium, calcium. Those also play a vital role into the health of our patients. And so we need to know signs and symptoms that go along with whether or not they have an elevated level or a subnormal level, and know those as it is associated with disease processes. So I hope that really helps. Don't forget to like and share the video, and I will see you next time. Bye for now.